I once heard that once you're diagnosed with diabetes, you're instantly put on insulin. Is that true?
It is a myth that all people with diabetes will immediately need to go on insulin. Many people can be treated with medications as well as diet and exercise. Most people will be started on oral medication or pills and then be encouraged to change their diet and to exercise. And for the vast majority, this is going to get their diabetes under good control. Sometimes when a person first comes in with diabetes, their sugars will be so high that the doctor or the prescriber is going to recommend insulin therapy. For someone who really feels strongly that they don't want to go on insulin, there's a lot that one can do to get the blood sugar down. Specifically, to work hard to increase exercise, to lose weight, and to really change the diet to cut down on carbohydrates, especially cut down on sugars. And those steps can bring the sugars down a great deal. It's clear that people who are committed to getting their sugars under control without using insulin often can have a big impact.
Diabetes runs in my family, but I don't show any symptoms, so I'm good, right?
It is a myth that all people with diabetes will have symptoms. You may not know that you have it. You may be feeling fine, and the blood sugars are still high. Some people, when they initially present with diabetes, will have symptoms. Those symptoms can be blurry vision, a dry mouth, urinating frequently, losing weight unintentionally. But there are many people, in fact most, when they're first diagnosed with diabetes, they don't have any symptoms at all. They might feel perfectly fine, and it's something that simply gets picked up on a blood test when they go in for a medical visit. Even without symptoms, diabetes needs to be treated. It's a serious condition, and it's one that won't necessarily result in the person feeling better immediately, but the treatment is so important to prevent long-term problems and to keep that individual feeling good and feeling healthy. Some people who come to their doctor and are diagnosed with type 2 diabetes will often want to work on their blood sugars through diet and exercise alone. Well, we now know that when people take metformin, that reduces diabetes complications of all types, and it also helps people lose weight. So there's a current recommendation from the American Diabetes Association that anybody with type 2 diabetes should be started on metformin as soon as the diagnosis is made.
I'm a little curious. Where can I find out more information about diabetes?
There are a lot of places that one can get information about diabetes. Some of that information that's out there isn't necessarily accurate or reliable, so a person needs to be careful about where they get their information from. I often recommend to my patients to look at the Durham Diabetes Coalition website or the American Diabetes Association website. They have a lot of great information that's about all aspects of diabetes. Another resource that I recommend to people is to look at the Medline Plus website, which has information about a broad range of topics, and it's put together by the National Library of Medicine. Another place people can go for information is to go to their public library. The librarians can direct them towards books or magazines or other resources, and they have a lot of good information for people who want to know more about how to care for their diabetes. Another source of information of diabetes, of course, is going to your medical provider. Often the doctor or nurse practitioner or nurse or pharmacist in the office can offer you a lot of information and materials about type 2 diabetes or type 1 diabetes. Many individuals with diabetes live a long time, and often that's a long time without any complications or any serious problems related to their diabetes. For example, I have patients in my practice who've been diabetic for 50 or more years who are doing quite well, living independently. They've had no major complications and really take good care of themselves, and they feel good every day. So I encourage people with diabetes not to take this as a sign that they're going to be impaired or feel terrible, but rather this is an opportunity to take good care of yourself and to do the things that really we know improve health, and look forward to many years of feeling good.